in allied health, it's not as distinct. Like you're usually working with the provider very quickly from when you get placed in the room.
Right.
And but in some professions, I mean, like I'm sure when you were pregnant with your kid and you go to an OB/GYN, there's the person taking your blood. They're not the nurse, right? But then the
Right.
nurse comes in, and then there's the OB/GYN, and then there's the PA, and you have all these different people, and you're like, the ability to reference like what is your role? Because
Yeah.
I went to this I recently had an appointment, and this woman comes in and she's like, "Yeah, I'm going to take some blood and run some numbers." And I was like, "Great. Are you the doctor?" And she like looked at me. She's like, "No, I'm just the medical assistant." And I like she was so offended almost that I was asking, and I'm like, "I'm just trying to like place you in my map." So
Right.
then a guy comes in, and he's like in scrubs that are like the light blue. Like scrubs have an inverse relationship. The worse they are, typically the higher ranking the person is. You know what I mean? Like that's my little thing about scrubs. But anyway, so he comes in, and I'm like, he's doing something, and he doesn't introduce himself, goes right into, "Hey, can you do this and this and this?" And he's poking around. I'm like, "Okay, are you the doctor?" And he's like, "No, I'm just the nurse." And I'm like, what is it with people being offended in this? Like, I'm just trying to figure it out. And then finally, this woman comes in. She's also in scrubs. I'm like, look, sorry, are you the doctor? And she's like, "Yeah, I'm doctor, whatever." And I'm like, thank God. And she's like, "What's the problem?" And I'm like, and now I'm like, "Oh, you think that because you're a woman, I'm thinking you're not like, I think her perception was I was being sexist, but I was just like, the third time, can somebody freaking tell me your role? Please,
Right. Tell
God."
me who you are. Yeah.
Right. And what you do
Yeah.
here. And it's fine. I don't care what it is. But if I know you're Rachel, the acupuncturist, this is Stacy, the, front desk coordinator, totally fine. I just want to know. I just want a little reassurance as I'm spinning
Right.
up with all these things in my head. So it's just,
Right. Yeah.
yeah.
Yeah. The other thing that I really took away from the live event was I realized that I was interrupting people talking. And I think with good intention, I was trying to like clarify something they were telling, something I had seen
Yeah.
in their paperwork that they had filled out, or
Mm.
trying to get to the bottom of whatever issue they're coming in for. And so doing the exercise that we did with having each other speak for 2 minutes and just see like that was very eye-opening for me, because I realized like, wow, I really am interrupting people so quickly.
Yeah.
And it's with good intent. I don't mean to like talk over them. I'm trying to understand, but I've realized that just letting them say their piece for a couple of minutes and explain the whole thing, then I usually get most of the information that I need. I don't need a lot of clarification if I just let them talk, you know?
Yeah. It's great to hear that. And I hear that all the time from people, because I think you're right. Like whether it's in a personal relationship or not, I think us interrupting and trying to clarify is me saying, "I know you're in pain. I see you're in pain. I want to remove the pain as fast as possible." But we also forget that that human just wants to share the emotional piece with us,
Right.
you know? And it often makes a huge difference, we hear in the weeks after. But can you think of a specific case where you listened? And I've found sometimes when you get past about a minute, every once in a while, you'll hear an absolute doozy in that second minute. And you're like, whoa, I wasn't waiting for that, you know?
It happens on a fairly regular basis that patients will fill out, or when they call and my staff books their appointment, they put notes in the appointment about what the patient said they were coming in for.
Mm-hmm.
And then the patient fills out their paperwork online. And sometimes those two things don't match. Like what they told the staff they wanted to be treated for is different than what they filled their paperwork out for. I just had somebody yesterday that they said low back pain when they booked the appointment, but then when they filled out the paperwork, it was neuropathy. I'm like, okay, so what are
Mm.
we doing? So then coming into the room, I just, introduce myself and say hello, and then ask like, how can I help? What can I help with? And then just see what comes out. Is it going to be the low back pain or the neuropathy? Or sometimes it's a little bit of both, but that happens multiple times a week, I would say, where someone, when they book the appointment, they might say one thing to the staff, but then when they get to filling their forms out, maybe other things come up and they
Yeah.
decide like, oh, I didn't know that I could be treated for that. And so
Yeah.
that's helpful, because then I'm not walking into the room with a preconceived notion of like, okay, let's work on your back. And really what they want to work on is their neuropathy, but I steer them toward working on their back, so I think that's been really helpful.
Thanks for tuning in to this episode of Trust Driven Insights, brought to you by Trust Driven Care. Imagine a world where all your patient communication is in one place, seamless, effortless, and on autopilot. That's the power of trust-driven care. If you're ready to streamline your practice, check out trustdrivencare.com and see what's possible. Trust-driven insights, real conversations, smarter care, stronger business.